That's right.
Hello, my name is Teresa Snyder, and I am your media host here in Amarillo, Texas. And today I'm very, very excited to have a couple of really intelligent, way out of my intelligence skill practice, yet they are fantastic, amazing people here in the Texas Panhandle. I am currently a community liaison, and I work in Amarillo in the home health and hospice industry, but that's not what we're really here to talk about today. I'm going to ask each of you to introduce yourself. So ladies first, Dr. Neese, you're up.
Hi, Teresa. I'm Susan Neese. I am a general internal medicine physician here in Amarillo, Texas. I've been in private practice for 20-something years. That's about it.
And I'll go on and on here in just a second. So, Dr. Peterson, would you like to introduce yourself?
Sure. My name is Darren. I'm a bariatric surgeon. I've been here in the community for about 6 years and about 15 years, and very much involved in the health and wellness side of medicine.
Absolutely.
Awesome. Well, my master's degree is in exercise and sports science.
Fantastic.
So this is my love language.
Great.
It's definitely my love language. So my first question, Dr. Neese, is going to be, what has it been like with COVID and everyone wearing masks and not really being able to eat healthy or take care of themselves?
It's been challenging. It's been overwhelming a lot, but I think people rallied and are doing a much better job wearing masks. We can get them to wear masks and socially distant. I know we're not right now, but we've both been vaccinated and been around each other constantly. So I think we're good.
I get mine tomorrow.
Excellent.
Tomorrow. I don't know if I should say that out loud, but anyway, keep going.
One of the biggest things that I thought was that we didn't focus enough on when it came to COVID was, why were people getting so sick and so severely sick and dying from COVID? What are things that can be done to lessen your risk of dying from COVID and getting so sick with it? When they shut the gyms down, I think that was probably not the best idea, because I'm a true firm believer that exercise consistently 4 to 5 days a week for 30 minutes to an hour will add years to your life. It so boosts your immune system and really settle down some of the inflammation with this virus. So people who are exercising are not getting near as sick with COVID as people who are not.
Very interesting. So now let's toss it over to Dr. Peterson. And what are you seeing in regards to what we're talking about as far as health and those that are getting more sick or less sick, just in your opinion?
Well, as Susan kind of alluded to, and our frustration has been that from a medical perspective, the only message that's been out there is a message of mitigation. That's all you hear. Mask, social distance, stay inside. But there's not been any other message. And there's actually really good data that supports the notion that your overall health and wellness plays a huge role in how you're going to respond to this if you do get it. And so we play a role in patients' lives trying to help them understand, how do we get healthy? The incidence of obesity in this country has skyrocketed over the last one generation. 100 years ago, obesity essentially didn't exist. And today, 30+% of our population is considered morbidly obese. So when we have a population that's so obese, we're finding, and there's good data that shows that patients that are morbidly obese are much more susceptible to this disease when you get it, and have significantly increased severity of illness. And so we play a big role in helping patients understand that there are solutions to obesity. Not just surgery. Surgery can play a role in it. Nutrition, Susan said, exercise, other lifestyle issues are very important in helping us get healthy.
Yes. And so, Dr. Neese, do you want to comment in regards to, and I'm such a nerd, I listen to podcasts all day, and this is why I love that I'm having this conversation with the two of you. So, Dr. Neese, would you like to add anything in addition to?
Well, I agree with Dr. Peterson. I mean, it is amazing to see the difference between patients who are overweight or obese versus normal weight and how they do in response to COVID. There was one study that showed, if you're overweight, I think it was overweight or obese, you had a 48% higher risk of dying from COVID. That's astronomical. That's unheard of in any other disease. We not only have a pandemic going on, we also have an obesity epidemic that I think is one of the big issues that we miss the mark on and not addressing to get the word out to people that really lifestyle changes need to be made. Initially when COVID came out, we had no treatment for it. And it is really to take their health into their own hands and start making some significant lifestyle changes to improve their health overall. I mean, there's a lot of work that I think needs to be done and a lot of messages that need to be put out there for people to know.
And I'm in an accountability group right now. And again, I believe health, vitamin D, drinking water, a lot of those things. And now, so Dr. Peterson, what type of surgery do you recommend with these people that are obese? I read all of your background and your bio and watched your YouTube video. So I have a little bit of knowledge from that perspective, but it sounds like there's some fascinating new techniques.
So just to kind of dovetail from what Dr. Neese was saying, we believe very strongly that COVID is exploiting how unhealthy as a society we really are. And so in the world of health and wellness, obesity obviously is a big factor in all that. And so there's multiple things that go into helping a patient get healthy. It's not just surgery. We can talk about that for just a minute, but we believe very much in a comprehensive approach, understanding that nutrition is hugely important. We spend lots of time educating patients on what nutrition should look like. Same thing with exercise. How are you exercising? What are you doing? And is that aligning with your goals? If you're trying to run a marathon, you're going to train in a completely different way than if you're trying to get healthy and if you're trying to lose weight. So we teach patients to understand what that looks like. And then again, lifestyle issues. But when patients come to a point where those three alone, we have programs that are just those three. But when patients get to a point where just those three alone aren't enough, then we start talking about surgical procedures. In this country, there's 4 different procedures that exist. There's the gastric bypass that's been around for 50 years, the lap band that's been around for 25, 30 years, the lap sleeve, which has been around for about the same amount of time, and then a newer procedure called the duodenal switch. In our program, we do not do the gastric bypass. I could speak to you for an hour as to why. We believe it's a flawed procedure. It has many, many long-term complications and do not believe it's a good option for patients. And as a replacement, we do a procedure called the duodenal switch, the switch for short, that calls on the same mechanisms. The way that it works is done much more safely and with many fewer complications long-term. We do not do the band because we believe that losing weight is simply a calories issue. That's what people have been taught for decades, literally a generation, is that it's all calories world, calories in, calories out. Jenny Craig, Weight Watchers, the list goes on and on. There are variations of the same thing, just trying to help you cut calories. But we do not believe that's where the answer lies in helping lose weight. And procedures like the band, which just puts a tight band around the top part of the stomach, is simply designed to force you to take in less calories. And so we don't believe in that procedure. The sleeve, which was developed about 30 years ago, was initially developed with that same idea in mind. If we remove part of the stomach and create a smaller sleeve-appearing stomach, well, we're going to force patients to eat less food. What they found was the procedure was much more effective than they ever imagined that it would be. And what we've since discovered is that the portion of the stomach that we remove is involved in producing many of the hormones that helps us achieve weight loss in a sustainable way. A concept has emerged through all this investigation called the Setpoint Theory. What that basically says is that everybody has a genetically imprinted set point in the brain that says, I want my weight to be here. And simply dieting, simply cutting calories will force your weight below that set point, but that's not where your body wants you to live. And it's going to constantly try to pull you back. Hence the roller coaster that people get on, where they cut calories and they lose some weight and they swallow and gain it all back.
Okay, so can I ask a question there?
Sure.
Okay, so definitely, this again is a topic that I love. I am a female that has experienced being heavier in my lifetime and then got into teaching group exercise, and I have ran 2 half marathons. Here's the thing is I give people this like, yes, let's be accountable to one another. However, what's a baby step? What's a step to kind of get people, instead of, oh my gosh, I'm going to have to run. I'm going to have to, you want me to train for a half marathon? And they they shut down. That doesn't motivate them. So Dr. Neese, you're shaking your head. Let's go back to Dr. Neese.
Yeah, it's absolutely overwhelming. And to really make life changes that are going to be long-term, you need to take baby steps. My number one thing I'm a true firm believer in is you need to lower your carbohydrate intake. We as a society eat carbohydrates with every single meal in the United States of America. And I'm talking the bad carbohydrates, bread, pasta, rice, all that. And we can handle that. That is leading to a huge amount of obesity and diabetes in the United States of America. Cutting your carbs down will make a big difference. Going for a walk, to start with even just 15 minutes 4 days a week. If you make something, you do something consistently for a couple of weeks, it's going to become a habit. And it's overwhelming to say, oh my gosh, I'm this size and I need to be this size by such and such time. That's just not even reasonable for most people. It has to be done in baby steps that a little thing at a time will end up with big changes down the road.
Well, let's kind of wrap this up because we've had a lot of great viewers, and I feel like that the people that share this out, how in the world are you guys taking new patients? I mean, we could go on for hours, at least I could, because this is just such a great, juicy topic. Yet I also want to make sure that not patients yet, people know how to either get a hold of you guys or what is something you're working on so that they'll know what to do next. So Dr. Neese, you go first, and then Dr. Peterson.
Well, I am taking new patients. I do general internal medicine. So when you come to see me, of course, I'm going to promote exercise and lifestyle changes, but also make sure your blood pressure is under good control, that diabetes is under good control. Those are extremely important to help you fight and lower your risk for developing severe issues with COVID. I have a private practice. Feel free to call. I'll be happy to help. So.
Awesome. So you saw and heard that, and I go see Dr. Neese a lot, and I think she's fabulous. Okay, Dr. Peterson?
So we are obviously accepting new patients as well. And we accept patients both who are considering surgery or patients who don't. We have a whole non-surgical program that addresses all these things, helps patients understand how you get started, starts to teach you how to change your nutrition, how to start exercising. We have an absolutely amazing health coach and personal trainer. At least I think she's pretty awesome.
She's pretty good. She could be a little bit.
That has written an amazing curriculum that really helps patients start to understand, where do I even commence to begin to start? And so that's something that we do offer for patients that are interested.
That is so awesome. Well, I'm going to go back and put some of these notes in the show notes or in the comments. I encourage both of you to do the same. You know, if you have phone numbers or websites or anything that you want to put in the comments, this can be found on Facebook. This can also be found on YouTube. And I just want to acknowledge you each. So again, I'm going to start ladies first. Dr. Neese, I acknowledge you for even the changes I've seen and recognized in you over the years. I see just really a lightheartedness, a bright smile, very interactive and engaging. And I do, hands down, I'm proud of you for being a national women's physician.
Thank you.
Yes. And so, Dr. Peterson, I want to acknowledge you. Welcome a Red Raider fan here to Amarillo, Texas, who's bringing a whole different broad aspect and a broad approach to the way we do health. And I just really acknowledge you both for taking the time. Is there anything in closing that either one of you would like to say?
The only other thing is that
I'm not in a rush. I just don't want to take up all of your time. So
no. My partners actually just had a program that came out on TLC last week. It's called Obesity Med. And you can view that on TLC currently. That goes through the life of a couple of our patients and the trials and tribulations, one that struggled quite a bit, which is real life, and the other one that did very, very well. So check that out. It's called Obesity Med on TLC.
Very cool. So, you know, those of us that have had to quarantine, that's something good to watch.
For sure.
That's what I tell people all the time, even as long as I've been in the fitness industry. Do your research. Get into contact with the people that know. You know, there's so many different fads and things. Do your research and call the people that you know, love, and trust. So Thank you both so much for being here. And if you'd like to do this again, I'll get with Dr. Neese and we can do this again.
Great.
Sounds good.
Sounds great.
Awesome. Okay. Bye.
Thanks, Teresa.
Super Friday.
Take care.